1 month post Asian eyelid surgery. Creases high and deep set, making my eyes look hollow. Can massage fix this? What can I do to make the crease less deep and more natural looking? Massage? Warm pack? Crease is 8 millimeters from the lash line. Did the doctor make too tight of a connection to the levator muscle?
Thank you for your question. You have submitted several photos and you state in your question that you are 1 month after undergoing Asian eyelid surgery and you want to know what you can do to deal with what you perceive as the eyelid crease being too high and too deep. You state that the crease is 8 millimeters from the eyelid margin and you're asking whether massage will help. Well, I can certainly give you some guidance as to what to anticipate after undergoing Asian eyelid surgery. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Asian eyelid surgery is a significant part of my practice. I do everything from non-incisional to incisional, as well as complicated surgeries such as eyelid surgery related to thyroid eye disease and eyelid ptosis, as well as revisional surgery. So I think that this is something that I'm sure when you had your consultation with your doctor was discussed, but I find that as someone who's been practicing a long time, it's one thing to describe it during consultation, it's another thing to kind of live through it. So what do I mean by that? Well, whether you do a non-incisional Asian eyelid surgery or an incisional Asian eyelid surgery, it is very much the norm to have a fair amount of swelling between the eyelid crease and the margin. And why would that be? Well, the idea of Asian eyelid surgery, simply stated, to form a double fold or to form a crease, there has to be a connection made between the skin and the levator muscle. And that connection has to be strong, it has to be stable, it has to be able to withstand this healing process after the surgery when there is swelling. And when there is swelling, it's almost like there's kind of a limitation of how quickly the fluid can go when there is an anchoring of the skin to the levator muscle. So there's this, relatively speaking, larger amount of swelling that causes the eyelid crease to look high. Now, in the first month is usually the peak of this degree of swelling. After that, it slowly, progressively gets better and better. And generally speaking, it reaches a point where it becomes fairly imperceptible. And when I explain the surgery and swelling, regardless of the type of surgery, swelling to a certain degree can last for months. And true healing after surgery is really 1 year. So now you're 1 month out and you're only really in the beginning of the most important process. In addition, I would say that from my experience, for whether it's Asian eyelid surgery or non-Asian eyelid surgery, most of the time I would say there's a relative stability of appearance by about 6 months. So I think that it's very important that you follow up with your doctor. I'm sure when you chose your surgeon that you had confidence that your surgeon was experienced and really understood and performs Asian eyelid surgery with significant enough frequency, that I'm sure that your surgeon did mention this to you. But again, like I said, I think that a lot of times it's living through the process that often becomes unsettling. So I always encourage my patients to contact me at any time, but I also schedule my follow-ups kind of closely. So for a lot of my Asian eyelid surgery patients, I see them at 1 week and then maybe 2 to 3 weeks later, so it kind of comes closer to 1 month, and then a month after that, basically to help guide them and coach them along. And it is normal to see a relative nice progressive trend of of resolution of swelling. And so by 3 months or so, I would say, even though there's still some swelling, most people are reasonably comfortable. But as far as people going back to work and doing their normal activities, after 1 month, it's usually not too bad and doesn't draw very much attention. So you just have to be prepared for that. So I would again recommend that you contact your doctor, maintain close communication. Your doctor who performed your surgery was the one who knows your anatomy very well and knows what to anticipate and plan your surgery accordingly. So from my perspective, without knowing what you looked like before and the details of your surgery, I would say that there is nothing unusual about having this degree of swelling at this time. As far as expediting the fluid egress to reduce the fluid, I think it's not necessary to do warm compresses. I always encourage my patients to just walk, talk, move, and sometimes I tell them to just look down, look up, and just kind of move that eyelid a little bit more. Sometimes people splint and not open their eyes very strongly, so I have them just look up periodically just to make sure that they get the full range of motion of the muscle as well as some activity to help kind of encourage fluid absorption. So I hope that was helpful. I wish you the best of luck, and thank you for your question.